Hello, hello. Good morning. Good morning. So, how's everything? Fine. So, let us start with this high yield MCQs for you. Good morning to all of you. So, starting with the first MCQ. Here we go. Answer this. I'm Dr. Pradeep Pawar, Professor of Anatomy. Been teaching anatomy since 21 years. Okay, answer this MCQ. Which of the following structures pass through the greater sciatic foramen? You can answer, students. Whatever you know, you answer. That's okay. Even if it is wrong, don't retract your messages. Let us have an interactive session. Come on. So, which of the following structures passes through the greater sciatic foramen? The answer is, yes, the answer is superior gluteal nerve and vessels. The superior gluteal nerve and vessels. The answer is superior gluteal nerve and vessels. This is the one which is passing through the greater sciatic foramen. Greater sciatic foramen. Have a look at the slide and try to understand this, students. Answer is A for this. Okay. Now, what is this? What is this here? This one. This is a greater sciatic notch. Greater sciatic notch. And what is this? That's a lesser sciatic notch. What is this ligament here? That's a sacrotuberous ligament. And what is this ligament here? This is the sacrospinous ligament. The sacrotuberous and the sacrospinous ligament are going to convert these notches into two foramen. Do foramen bante hai. What is this foramen that you get? The greater sciatic foramen. And what is this foramen? The lesser sciatic foramen. That's how you get the greater and the lesser sciatic foramens. Pehle notches hote hain, baad mein ye foramen ban jate hain. Now, what is this? This is the ischial spine. I draw a line from the pubic symphysis to the ischial spine. Like this. We draw a line from the pubic symphysis to the ischial spine. And what is this line known as? This line is known as the white line of pelvic fascia. White line of pelvic fascia. What is this line? It begins from the pubic symphysis. It goes on either sides to the ischial spines. This line is known as the white line. And tell me, students, this white line of pelvic fascia gives origin to something. It gives origin to a muscle. Can anyone answer this? What is this muscle? The white line of pelvic fascia, half muscle comes from this side, other half will come from this side, and they're going to interdigitate here. What is this muscle? A very important levator ani. Very good. That's a levator ani. Levator ani. So what is the origin of levator ani? It is the white line of pelvic fascia. Ye clear hai? And what is this white line? Begins from the pubic symphysis and goes on either sides to the ischial spine. This is the levator ani. That's the origin of levator ani. This levator ani is going to divide this pelvis. Okay, that's a pelvis, the levator ani. This is the true pelvis. Ye pelvic brim hai na? So this is the pelvis, true pelvis. The levator ani is going to divide this true pelvis into two parts. One above the levator ani, this is what we call as the pelvis proper, and below the levator ani, students, this is what we call as the perineum. So ye hoga pelvis proper and ye hoga perineum. You are understanding this? That's the levator ani. Above the levator ani, what we have is the pelvis proper, and below the levator ani, that's the perineum. Now, if you can tell me who lies in this pelvis proper? यहाँ पे होगा bladder, the urinary bladder, the uterus and the rectum. The bladder, the uterus, the rectum, they lie in the pelvis proper. They are going to lie on the levator ani. They would lie on the levator ani. And what is going to pierce the levator and come down into the perineum? The urethra, the vagina and the anal canal. The urethra, vagina and anal canal, they lie in the perineum. Okay, they lie in the perineum. They pierce the levator ani, they enter the perineum. So who's the content of perineum? The urethra, the vagina and the anal canal. And this pelvis mein kya hota hai? Bladder, uterus and rectum. Just understand this concept, everything will be clear. Now students, if any structure has to get out of the pelvis. ये pelvis proper है. If any structure has to get out of the pelvis, how does it get out? It can get out through this greater sciatic foramen. It can get out through the greater sciatic foramen. Any structure, if it gets out through the greater sciatic foramen, where does it go? Which region does it go? I'll change the slide for you. Okay. If any structure gets out through the greater sciatic foramen, which is that region in which it goes? Anyone? What's up there? Okay, I've got only this one slide for you. Which is this region? If it gets out through the greater sciatic foramen, that's the gluteal region. I don't have the other slide. It goes into the gluteal region. मतलब कोई भी structure अगर greater sciatic foramen से बाहर जाता है, it's right inside the gluteal region. There are three options for that structure now. There are three options. One, it remains in the gluteal region. Can you answer this? It remains in the gluteal region. Example is the superior gluteal nerves and vessels, the inferior gluteal nerves and vessels. And they're going to supply the muscles of that region. The second option, from the gluteal region, the structure comes straight down. But the gluteal region, say if we come straight down, where are we? We are in the posterior compartment of the thigh, posterior compartment. Or the third option is, the structure will turn around. It will go out like this. It will go out. It will turn around. bahar se. It will turn around the ischial spine and it will enter into this lesser sciatic foramen. Where does the structure go now? Into the perineum. Matlab the structure gets out from here, gets out from the greater sciatic foramen. It turns around the ischial spine. And it comes into the lesser sciatic foramen. It is now inside the perineum. Tell me students, who will do this? Ye kaun karega aise? Who is this? Who will get out of the pelvis, turn around the ischial spine and enters the perineum? Anyone? Can you answer this? These are the pin structures. Pin. Yes. Who's this P? Pudendal nerve. I, internal pudendal vessels. N is the nerve to obturator internus. So pudendal nerve, internal pudendal vessels and the nerve to obturator internus. These are the three structures which are coming in the lesser sciatic foramen. And students, if you can tell me, there's one structure which is getting out from here. What is this opening here? What is this opening? And what is this foramen? That's the obturator foramen. And there's a muscle right here. What is this muscle? What is this muscle going to be? That's the obturator internus. And the tendon of obturator internus will be getting out from here. It will get out from here. You understanding? So the tendon of obturator internus gets out through lesser sciatic foramen. And there are three structures which are entering the lesser sciatic foramen. Kaun hai ye? Pin. P-I-N, pin. Okay, I'll just mention this, but just write this down so it will be clear for you to understand. Yep, likh lete hain, chalo. So what are the structures which are getting out through the greater sciatic foramen? Structures getting out through the greater sciatic foramen. Let us just jot this down. One is the superior. This is very important, students. This is extremely important. This you have to know. Superior gluteal nerve and vessels. Superior gluteal nerve and vessels. Inferior gluteal nerve and vessels. Third, sciatic nerve. Fourth, posterior femoral cutaneous nerve of thigh. Posterior femoral cutaneous nerve of thigh. Fifth, a muscle. I didn't write this. Piriformis. That's a pure shaped muscle which comes out. That's a piriformis. Sixth is nerve to quadratus femoris. Nerve to quadratus femoris, and that's an MCQ. And this nerve to quadratus femoris supplies two muscles. ये दो muscles को supply करता है. एक तो quadratus femoris को supply करेगा, and the other muscle which it supplies is what? Can anyone answer this? The nerve to quadratus femoris supplies two muscles. One is the quadratus femoris and anyone? It supplies the quadratus femoris and inferior gemellus, quadratus femoris and the inferior gemellus. Seventh is pudendal nerve. Pudendal nerve. Nerve to quadratus femoris hai bacha. Shreyans, it doesn't supply obturator internus, it will supply quadratus femoris and inferior gemellus. Pudendal nerve. 8th, internal pudendal vessels, and 9th is nerve to obturator internus. ये दो मसल्स को सप्लाई करेगा, एक तो ये ऑब्चुरेटर इंटरनस को सप्लाई करेगा एंड द अदर वन इज द सुपीरियर gemellus. So the nerve to obturator internus supplies the obturator internus and the superior gemellus. ठीक है students? And remember one thing, these three structures, the pudendal nerve, the internal pudendal vessels and the nerve to obturator internus, they wind around. They wind around the ischial spine and enters the perineum through lesser sciatic foramen. Lesser sciatic foramen. This is perfect. So these three structures, in pudendal nerve, internal pudendal vessels and the nerve to obturator internus, they wind around the ischial spine and they enter the perineum through the lesser sciatic foramen. एक last चीज, the tendon of obturator internus, the tendon of obturator internus leaves through lesser sciatic foramen. It leads to the lesser sciatic foramen. Okay, be very clear. इसमें बहुत MCQs are covered. Look, so what are the structures which pass through the lesser sciatic foramen? There are three structures which come in, and there's one structure which gets out. Who gets out through the lesser sciatic foramen? That's a tendon of obturator internus. And three structures come in. That's PIN. Pin. Fine, perfect, bacho. Is this clear to all of you? This is very important MCQ. Okay. That's it. Now, coming to the next MCQ. Okay. Yeah. Sure. Answer this. Sacrotuberous ligament is a degenerated part of which of the following muscles? Yes, can anyone answer this? Sacrotuberous ligament is a degenerated part of which of the following muscles? Sam. But let the others answer, Sam. Wait. Yes, Shreyans. Very good. What's that? Long head of biceps femoris. Yes. Sacrotuberous ligament is a degenerated part of which muscle? Yes, your answer is the long head of biceps femoris. Very good. Long head of biceps femoris. Now, have a look. Understand this. We're just discussing this muscle. Look here once again. Right. Tell me now. But I'll just come to this slide. Now, ischial tuberosity. Another very important MCQ you get is on the ischial tuberosity. If I draw this as the ischial tuberosity for you students, ischial tuberosity, the bone on which we sit, ischial tuberosity, we divide this ischial tuberosity into 4 quadrants. ऐसे 4 quadrants में divide करते हैं. If this is going to be lateral and this is medial, lateral and medial, so this is what we call as the suprolateral, this is what we call as the supromedial. Supromedial quadrant, suprolateral quadrant, this is the infralateral quadrant, and that's the infromedial quadrant. Infromedial. Okay, so these are the 4 quadrants of the ischial tuberosity. Tell me students now, what are the muscles which arise from the ischial tuberosity? Very important. So what arises from the supralateral quadrant? That's the semimembranosus. What arises from the supromedial quadrant is the semitendinosus and long head of biceps femoris. Semitendinosus and the long head of biceps femoris. What arises from the infralateral aspect is the adductor magnus. Adductor magnus. And what arises from the inframedial aspect? From the inframedial aspect, there's nothing here, students. There is a bursa here. Bursa. Just remember this. Okay. So what is present on the inframedial aspect of the ischial tuberosity? There's nothing there. There's a bursa. And we are exactly sitting on this bursa. And if you sit for a long time, there's an inflammation of this bursa over the ischial tuberosity. And this is what we call as, anyone, what is this known as? Inflammation of the bursa over the ischial tuberosity. What is this known as? If you sit for a long time, you get bursitis over the ischial tuberosity. Yes. And this is what we call as Weaver's. Weaver's. It is also known as Taylor's, or it is also known as the student's bottom. Okay, so that's inflammation of the bursa over the ischial tuberosity. Weaver's bottom, Taylor's bottom, or the student's bottom. Can anyone tell me what is the inflammation of pre-patellar bursa known as? Yes, students, inflammation of pre-patellar bursa is known as what? Chalo, bolo. This is a reference to it. Inflammation of pre-patellar bursa. Anyone? Housemaid's knee. Very good. Inflammation of pre-patellar bursa is known as housemaid's knee. Excellent. And inflammation of the infrapatellar bursa. Infrapatellar bursa is known as clergyman's knee. Clergyman is a priest who kneels down and prays. So clergyman's knee. Inflammation of pre-patellar bursa, housemaid's knee. Inflammation of infrapatellar bursa, clergyman's knee. And inflammation of the bursa over the ischial tuberosity is known as Weaver's bottom or Taylor's bottom. Weaver's or Taylor's bottom. Okay, perfect. Be very clear about this. So remember this also, you get MCQs on this also. What are the structures which are attached to which aspect of the ischial tuberosity? A very easy way to remember. So supralateral is semimembranosus, supromedial aspect of the ischial tuberosity is semitendinosus and the long head of biceps femoris. Infralateral is the adductor magnus and inframedial is a bursa. Bursa. Okay, fine. Now coming back to our MCQ. एक मिनट, sorry. Tell me now, students, what is this? A kind of muscle था. Long ago in our ancestors, there was a muscle, and this muscle was beginning from the sacrum. ये और ऊपर से आता है, not seen here on the slide clearly. So this muscle begins from the sacrum. It comes to the ischial tuberosity, and from the ischial tuberosity, this muscle goes down into the thigh. ये thigh में जाएगा. So this muscle begins from the sacrum, comes to the ischial tuberosity, and from the ischial tuberosity it goes to the thigh, posterior aspect of the thigh. अब जैसे evolution हुआ, as evolution has progressed, this much part of this muscle, this is the long head of biceps femoris. The long head of biceps femoris. Where was the long head of biceps femoris arising from the sacrum? It was arising from the sacrum. It comes to the ischial tuberosity, and from the ischial tuberosity it goes into the thigh. Okay, and in due course of evolution, this long head of biceps femoris got degenerated. ये degenerate हो गया. Now in us, if you see, the long head of biceps femoris is arising from where? Ischial tuberosity. It is arising from the ischial tuberosity, and this ligament represents the degenerated part of the long head of biceps femoris, and this is what we call as the sacrotuberous ligament. Sacrotuberous ligament. So sacrotuberous ligament is a degenerated part of which muscle? Your answer would be the long head of biceps femoris. Long head. Just wait, I'll write this for you, just listen. Now, we had a tail first. Okay, we were animals, our ancestors were animals, they used to stay on the trees, and the tail was very important for them. You know, there's a muscle which goes in the tail. Which muscle is that? The tail is very strong. The animal hits with the tail. Then the monkeys on the trees, they put the tail around the tree, they jump from one tree to the other tree. This tail is very strong. Can you tell me which is the muscle which is there in the tail? Anyone? Which is the muscle going in the tail? Bolo. The muscle in the tail is coccygeus. Coccygeus muscle hota hai ye. And then our ancestors came down, no? Our ancestors came down and started walking on two legs. Pehle when they used to walk on four legs like this, the tail used to go up in the air. Now when the ancestors came down and started walking on two legs, the tail used to rub against the ground. Iska koi function nahi tha. Gradually the tail went off. The tail went off. Okay. The muscle got degenerated and the muscle now become a ligament. And this is what? Sacrospinous ligament. Sacrospinous. This is the one. So sacrospinous ligament is a degenerated part of which muscle? Coccygeus muscle. Sacrospinous ligament is a degenerated part of coccygeus muscle. Another extremely important MCQs for you. I'll just jot this down for you. So sacrotuberous ligament. Sacrotuberous ligament. What is the degenerated part? Long head of biceps femoris. Long head of biceps femoris. Sacrospinous ligament. What is the muscle? Coccygeus muscle. Then there's something known as the tibial collateral ligament. I'm writing all the degenerated parts for you. आप बोल सकते हो? Tibial collateral ligament. मतलब if you see the medial aspect of the knee joint, students, if you see the medial aspect of the knee joint, there's a ligament here which extends from the femur till the tibia, femur to the tibia, and this is what we call as the tibial collateral ligament, or it is very commonly known as the fibular collateral ligament. Can anyone tell me? I mean, it is most commonly known as the medial collateral ligament. Tibial is also known as medial collateral ligament. Yes, which is the degenerated part? It's the adductor magnus. Yes, very good. It's a adductor magnus hai bacha. It's not longus. Aisha, it's adductor magnus. Okay. It's a degenerated part of adductor magnus. Next. Fibular collateral ligament. What we call this as the lateral collateral ligament, and this is the degenerated part of the peroneus longus. Peroneus longus. Very important. Very important. Lateral collateral ligament is a degenerated part of peroneus longus. ये सब degenerated parts हैं muscles के. Oblique popliteal ligament. Tell me, oblique popliteal ligament. Can anyone answer this? It lies in the popliteal fossa. ये है ना floor में होता है, ये floor of the popliteal fossa. And this oblique popliteal ligament is a degenerated part of. Anyone? Answer. Oblique popliteal ligament is a degenerated part of semimembranosus. Very good. Semimembranosus muscle. Okay, very good, very good. Popliteus nahi hai, Shreyans. That's a very common answer. Oblique popliteal ligament is popliteus. No. Oblique popliteal ligament is a degenerated part of semimembranosus muscle. Okay, clear to all of you? अब ये degenerated parts है बच्चों. There are some detached parts. ये degenerated है. There are some detached parts of the muscle. If you can tell me, Anconius is a detached part of. Anconius is a detached part of. Anyone? Can you answer this? Anconius होता है ना पीछे, ये in the back of the forearm. Anconius muscle is a detached part of. Can anyone answer this? Triceps. Very good. Which head? वैसे triceps के 3 heads है. There are 3 heads for the triceps. Long head, lateral head, medial head. So which head of triceps? To be very specific, it's a degenerated part of medial, detached part of medial head of triceps. It's a detached part of the medial head of triceps. And the last one is articularis genu. It's a detached part of. Yes, can anyone answer this? Articularis genu is a detached part of which muscle? ये थे degenerated parts and these are the detached part. मतलब a part of the muscle gets separated and is placed somewhere else. वैसे yeah clear? वैसे anconius is a detached part of the medial head of triceps and the articularis genu is a detached part of vastus intermedius. Very good. Vastus intermedius. Okay, articularis genu is a detached part of vastus intermedius. This is perfect. Again, a very important MCQ. This oblique popliteal ligament is pierced by something. Can anyone answer this? Oblique popliteal ligament is pierced by. Oblique popliteal ligament is pierced by. Another extremely important MCQ for you. Bolo bachcho, if you know this, you can answer this. Oblique popliteal ligament is a degenerated part of semimembranosus. This we know. And this oblique popliteal ligament is pierced by. Anyone? Oblique popliteal ligament is pierced by. It is pierced by. नहीं श्रेयांश. Median perforating branch of popliteal artery. नहीं. Median उसका नाम है. Oblique popliteal ligament is pierced by middle genicular artery. Middle genicular artery. That's a branch of popliteal artery. It's the middle genicular artery and posterior division of obturator nerve. Just remember this, students. So oblique popliteal ligament is pierced by middle genicular artery. वैसे popliteal artery 5 genicular branches देते हैं. Genicular मतलब they're going to supply the knee joint. So it gives 5 genicular branches, out of which one genicular, that's the middle genicular artery, is going to pierce what? The oblique popliteal ligament. Okay, it is pierced by the middle genicular artery and the posterior division of obturator nerve. This table, remember this, इस पर बहुत MCQs आते हैं. I hope everything is clear to you, my dear children. Okay, we'll proceed then. We'll proceed. Answer this. Anterior cerebral artery supplies which part of the brain? Specially curated MCQs for you all I made. Anterior cerebral artery supplies which part of the brain? Lateral कैसे बच्चा? How lateral? Anterior cerebral artery supplies which part of the brain? अब इसके साथ है ना associated सारे MCQs I'll tell you, So try to understand it like that. It is the medial part of the brain. Medial surface of the brain is supplied by anterior cerebral artery. Okay, we'll come to this. Have a look. Understand this. Okay, all the MCQs in association with this I'm telling you. Tell me, I'll make a slide for you. Medial surface, very good. So I'll make a slide for you. What is this surface of the brain? Can you tell me? And what is this surface of the brain? Can you tell me? This is one surface and this is one surface of the brain. Okay, bolo. What is this sulcus? Lateral sulcus. So what is this surface of the brain? Lateral surface, supralateral surface. That's a callosum, that's a corpus callosum, and इसके ऊपर एक sulcus होती है. What is this sulcus known as? Callosal sulcus. Callosal sulcus. Right. So this is the medial surface. ये lateral है. The first one is lateral and the second one is medial. Now why is this so important? Tell me. There's an artery here which lies in the lateral sulcus. And there's an artery here which lies in the callosal sulcus. Callosal sulcus. Can anyone answer this? What is this artery in the lateral sulcus? Middle cerebral artery. And the artery in callosal sulcus is anterior cerebral artery. This you should know. This you should know. So the artery in the lateral sulcus is middle cerebral artery. And the artery in the callosal sulcus is anterior cerebral artery. Okay, voice clear nahi hai? So the artery in the lateral sulcus is middle cerebral artery and the artery in the callosal sulcus is anterior cerebral artery. Now understand this slide that I am drawing for you. Tell me, what is this big artery? Ye bada sa artery hai. What is this big artery? It gives a branch here and then continues here like this. It gives a branch here and continues like this. Okay. And there's an artery which is coming from behind here. Very good, bachcho. Very good. What is this? What is this? And what is this going to be? Yo. And what is this artery now? This is something which you have to know. Huh? Yes, very good. Very nice, very nice. So I'll just quickly name the arteries. Ye kaun hota hai? What is this artery? This is the anterior communicating artery. Anterior communicating. This is the anterior cerebral artery. Anterior communicating, anterior cerebral, internal carotid, posterior communicating, posterior cerebral. Just one moment. I'll just be back in 1 moment. I'm so sorry. Okay, so what is this artery? This is the anterior communicating artery. Anterior communicating artery. This is the anterior cerebral artery, internal carotid artery, posterior communicating artery, and that's the posterior cerebral artery. Posterior cerebral. Okay, so what is this that I've drawn for you? This is the circle of Willis. Circle of Willis. That's the circle of Willis. Okay. So tell me students, the circle of Willis, sorry, ये ना थोड़ा सा गलत हो गया. 1 moment, this is not internal carotid. I'm so sorry. This is internal carotid artery. What is this artery? Middle cerebral. Okay, that's it. So, circle of Willis, another very important MCQ student. Circle of Willis is formed by all the arteries except, can you answer this? In all this, who doesn't form the circle of Willis? In all these arteries which I've labelled here for you, in all these arteries, who does not form the circle of Willis? The middle cerebral artery. Middle cerebral artery, yes, very good. So middle cerebral artery is not going to form the circle of Willis. Out of all these arteries which I have labelled for you, who doesn't form the circle of Willis? That's the middle cerebral artery. So circle of Willis is formed by whom? One is the anterior communicating artery, anterior cerebral artery, internal carotid, posterior communicating, and posterior cerebral arteries. Clear to all of you? So middle cerebral artery does not take part in the formation of circle of Willis. Remember that. Middle cerebral artery does not take part in the formation of circle of Willis. Clear? Okay. Now understand which part is supplied by which artery. Okay, I'll start with this. Have a look. Understand this. Now, if this is the anterior cerebral artery, the anterior cerebral artery is going to supply the entire medial surface. Entire medial surface is supplied by anterior cerebral. The anterior cerebral artery also goes on that side. That side, ये medial surface है. The anterior cerebral artery also goes on the lateral side. What is that? The superolateral aspect. And this part is supplied by whom? This part is supplied by the anterior cerebral artery. A small area on the superolateral surface is supplied by anterior cerebral artery, right? So anterior cerebral artery supplies the medial surface mainly. It climbs and goes on that side. A small area on the lateral side is supplied by anterior cerebral artery. The entire superolateral surface, is supplied by what? Middle cerebral artery. A small area here on the medial surface of the temporal lobe is supplied by middle cerebral artery. And who's this? ये कौन होगा? The occipital lobe is supplied by whom? The posterior cerebral artery. The occipital lobe is supplied by posterior cerebral artery. This is very important, very, very important. So the anterior cerebral artery is going to supply mainly which surface of the brain? Medial surface of the brain. Medial surface. Medial surface of the brain is mainly supplied by anterior cerebral, part of it is supplied by middle cerebral, part is supplied by posterior cerebral. The supralateral surface is mainly supplied by whom? Middle cerebral artery. Supralateral is mainly supplied by middle cerebral artery. Okay, ये याद रखना. This is very important. Right? Clear students? This is clear? Perfect to all of you. Now you tell me, what is the blood supply of the motor area? Motor area. Anyone? What is the blood supply of the motor area? Look, that's a central sulcus here, that's a central sulcus, that's a pre-central sulcus, that's a post-central sulcus, right? So this is motor, this is sensory. So blood supply of the motor or the sensory area, what is this going to be? So this much part would be supplied by whom? This much part is supplied by middle cerebral artery, and the part above is supplied by whom? Anterior cerebral artery. So if MCQ comes blood supply of the motor area or the sensory area, your answer is going to be MCA plus ACA. Both, very good, both. Blood supply of the motor or the sensory area, both the arteries, middle as well as anterior cerebral artery. Is this clear? Very important, blood supply of the motor area, blood supply of the sensory area, both MCA plus ACA. And blood supply of the visual cortex, blood supply of the visual cortex, what is it going to be? Or the occipital lobe? Occipital lobe is mainly supplied by the posterior cerebral artery plus the area of fine vision. What is that area of fine vision known as? Macula. That is supplied by middle cerebral artery. So blood supply of the occipital lobe, your answer is going to be PCA plus MCA. PCA and MCA. ये दूसरा MCQ बहुत important है. So occipital lobe or the visual cortex, the entire visual cortex or the occipital lobe is supplied by posterior cerebral, and that's area of fine vision. What's that? Macula. That is supplied by whom? Yes, the middle cerebral artery. So both the arteries. ठीक है? Clear to all of you? So that's about. Don't retract the messages. That's okay. Even if it is wrong, it's okay. You learn something. You learn many things. Yeah. Fine, students. Chalo, we'll proceed to the next MCQ. If you can answer this. Macular sparing. Macular sparing matlab if there's a thrombosis of posterior cerebral artery, the entire occipital lobe is involved except the macula is spared. वो उसका मतलब है. Because macula is supplied by middle cerebral artery. Understand? So posterior cerebral artery thrombosis होता है. So the macula is spared. ठीक है श्रेयांश? चलो, answer this. Middle meningeal artery, बच्चा. Middle meningeal artery is not foramen ovaleus. Middle meningeal artery passes to which foramen? That's the foramen spinosum. That's the foramen spinosum. Middle meningeal artery passes to the foramen spinosum. Tell me, what passes to the foramen rotundum? Can anyone answer this? Foramen rotundum? What passes to the foramen rotundum? Maxillary nerve. Maxillary nerve goes to the foramen rotundum. Foramen ovale, you know. M-A-L-E. What is M? Mandibular nerve. Mandibular nerve. A is the accessory meningeal artery. Accessory meningeal artery. L is the lesser petrosal nerve. And E is the emissary vein. Emissary vein. Okay. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. And this jugular foramen has got 3 compartments. ऐसे 3 compartments होते हैं. One is the anterior, middle, and posterior. Anterior, middle, and posterior. What passes to the posterior compartment? Can anyone tell me what passes to the posterior compartment? Sigmoid sinus. Sigmoid sinus. What passes to the anterior compartment? Anterior compartment, what passes is the inferior petrosal sinus. Inferior petrosal sinus. And middle compartment is 9th, 10th, and 11th cranial nerves. 9th, 10th, and 11th cranial nerves. Be very clear about this. जुगुलर फोरामेन के 3 कंपार्टमेंट्स होते हैं, एंटीरियर, मिडिल, पोस्टीरियर. So what passes to the anterior compartment is the inferior pectoral sinus, posterior compartment is the sigmoid sinus, and the middle compartment is the 9th, 10th and 11th cranial nerves. 9th, 10th and 11th cranial nerves. What passes to foramen spinosum? One is the middle meningeal artery and nervous spinosus. Middle meningeal artery and the nervous spinosus. Okay, middle meningeal artery and the nervous spinosus. This is clear to all of you? Okay, just see the slide and quickly tell me. Yep, here we are. Identify this. I just put arrows. You quickly. Very good. You know everything. Just quickly try to identify those foramens. Chalo, start. What is this foramen? Here. What is this foramen? Answer. Just put the initial. That's fine. Just put the first letter. Don't write the entire thing. What is that foramen? That's a foramen rotundum. Very good. What's this? This is the foramen ovale. What's this? That's the foramen spinosum. Foramen spinosum. And what is this foramen? Can anyone tell me what is this foramen? ये कौन है बड़ा सा foramen on the medial aspect? That's the foramen lacerum. That's a foramen lacerum. And what passes through the foramen lacerum? Anyone? What passes through the foramen lacerum? The internal carotid artery and the deep petrosal nerve. Through the foramen passes the internal carotid artery and the deep petrosal nerve. Deep petrosal nerve. What is this foramen here? Can anyone tell me what is this foramen in the petrous part of temporal bone? Petrous part के अंदर एक foramen है. Name. Petrous part के अंदर. That's the internal acoustic meatus. Internal acoustic meatus. And what passes to that? The 7th nerve, the 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and labyrinthine artery. Very good. The foramen in the petrous part is internal acoustic meatus. And who lies in this petrous part? The middle ear and the internal ear. That's the middle and internal ear. So this foramen is the internal acoustic meatus. There's a big foramen here. Can anyone tell me what is this foramen? यही है jugular foramen. ये है jugular foramen. And there's a foramen here on either sides. That is the hypoglossal canal. Hypoglossal canal. Clear, students? So all this is known to you. Now, I'll just tell you. Tell me what is this? There's something which is attached to the petrous part of the temporal bone. And there's something which is attached to this occipital bone here. ऐसे, There's something which is attached to the occipital bone here. And there's a gap left here. ये क्या हो सकता है? What can this be? अभी बोलो. There's something here like this, and if I draw this, no, ये ऐसे होता है, ऐसे. There's something here which is covering the bone. Yes, what is this? Very good. All of you have answered this. This is known as the Tentorium cerebelli. Tentorium cerebelli. What is this tentorium? Basically, this tentorium is a fold of dura mater. ये ऐसे fold होता है dura mater का, and it is who lies on this tentorium? Can anyone tell me who's lying on this Tentorium cerebelli? The occipital lobe of the brain. Occipital lobe lies on the Tentorium cerebelli, and who's below? इसके नीचे, here. Who's lying here below the tentorium is the cerebellum. Okay, so occipital lobe and cerebellum के बीच में there's a fold of dura mater, and this is what we call as the Tentorium cerebelli. Excellent, very good to all of you. Chalo, good, you answered well. And tell me, what is this sinus which is located in the Tentorium cerebelli? ये क्या sinus होगा? In the Tentorium cerebelli there's a sinus. This sinus is known as, anyone? This is known as the straight sinus. Very good. This is known as the straight sinus. Straight sinus is located within the Tentorium cerebelli. Straight. एक very important MCQ है. There's a very important MCQ. There's a nerve which pierces the the tentorium cerebelli at the junction of its free and attached margin. यहाँ पे nerve piercing the tentorium cerebelli at the junction of the free and the attached margin. उसके दो margins होते हैं. One is the free margin of the tentorium cerebelli and दूसरा होता है attached margin of the tentorium cerebelli, which is the nerve attached to the at the junction of the free and the attached margin of tentorium cerebelli. That's a trochlear nerve. Very good, Sam. That's a trochlear nerve. Just write this MCQ. Nerve attached at the junction of. ये लिख लो आप. So let this be there in your notebook. Nerve attached at the junction of the free and nerve attached or nerve present at the junction of the free and attached margins of tentorium cerebelli. Free and the attached margins of tentorium cerebelli is trochlear nerve. Okay. And tell me, what is this slope on the brain, on the skull known as? ये slope को क्या बोलते हैं? What is this slope known as? Here, this one. What is this slope known as? Huh? Yes, okay. ये slope को क्या बोलते हैं? There's someone who's lying on this slope. बच्चों, this is very important. This slope is known as the clivus. C-L-I-V-U-S. Clivus. The slope is known as clivus, and who's lying on this clivus? ये gap क्यों रखा है? Why is this gap left in the tentorium cerebelli? नहीं तो it would have covered the entire thing, no? Because who's lying on this clivus? The brainstem. The brainstem होता है ना, and the brainstem has to go down towards the foramen magnum. So this gap is for the brainstem to pass. ना तो brainstem यहाँ से नीचे जाता है. ठीक है? Clear to all of you? Just one last thing, you tell me in this slide, tell me what is this here? ये कौन है ये? What is this foramen? Yes, what is this foramen? That's the optic canal. And what passes to this? The optic nerve and ophthalmic artery. The optic nerve and ophthalmic artery passes to it. Clear? So optic foramen, optic canal, what passes is the optic nerve and ophthalmic artery. And what are these markings of? ये markings देख रहे हो आप? Look. ये देखो. What are these markings of? ऐसे skull bone पे, on the skull from inside there are the markings of something. What are those markings of? Anyone? Those are the markings of. Anyone? नहीं, arachnoid granulation नहीं. Those are the markings of what? Middle meningeal artery. ये middle meningeal artery के branches होती है ना, उसके impressions होते हैं ये. These are the impressions of the middle meningeal artery, right? Middle meningeal artery. Yes, middle meningeal artery. And यहाँ पे बच्चों, there's an H-shaped sulcus here. From बाहर से, from outside, that H-shaped sulcus. What is that H-shaped sulcus known as? From outside. Yo. What's that? The H-shaped sulcus is known as. So I'm finishing everything concerned with this slide. So no need to come back. So there's an H-shaped sulcus present on the lateral side. From outside you're looking, and this H-shaped sulcus is known as the pterion. And what lies deep to the pterion? Can anyone answer this? Who lies here deep to the pterion? The anterior branch of, another very important MCQ, what lies deep to the pterion? That's the anterior branch of middle meningeal artery. Very good. Anterior branch of middle meningeal artery, and the stem of lateral sulcus. So anterior branch of middle meningeal artery and the stem of lateral sulcus lies deep to the pterion. Okay, students. So before I come to the next slide, I'll just brief you about our platform. I'll just brief you about our platform. Now we've got a plus subscription. I'm still left with 2 MCQs. So we've got this plus subscription in which there are daily live classes, live quizzes, learning from the top educator, access from the device of your choice, and you're free to access the question bank with 25,000 plus MCQs. Okay. The iconic subscription in which you get the best of Unacademy and pre-platter. Special class features in which there is interactive live classes, poll for the learners, raise a hand technique, never miss a class with proper notifications being given to you. Lecture notes, if you miss a lecture, you can attend the recorded lectures, you get the PDF of it anytime, anywhere, you can access the class and get your doubts solved. Okay. A highly effective and updated question bank with the recent questions and a detailed explanatory answers has been prepared especially for your children. Raise a hand technique, when you press the icon there in your app, you can directly talk to the educator. Yes. And these are our toppers from the last NEET PG. We congratulate all of them once again. Now, you have got this free test schedule. Now, you've got this ritual test. We've got test on Wednesday. We've got test on Friday. We've got test on Saturdays. And you've got a compact, NEET PG compact and FMGE grand test. Okay. So just have a look at the schedule. Okay. So we started with 2 new batches students. We've started with Target NEET 2022 and Target Next Integrated System Wise batch from 17th of November. Download the Unacademy app and subscribe to it. Okay, if you can tell me this. Chalo, answer this students. Anterior neuropore closes by dash day of intrauterine life. Yes. Anterior neuropore closes by. Anyone? 25th day, very good. Anterior neuropore closes by 25th day of intrauterine life. If it does not close, it results in anencephaly. The posterior neuropore closes by. Yes, answer this. A very important MCQ for you children. The posterior neuropore closes by 28th. First we used to say 27th. Ab hum bolte hain 28th day of intrauterine life. If it does not close, it results in spina bifida. Spina bifida. Okay, so that's how the anterior and the posterior neuropore is. Now see, this is the ectoderm students. This is the ectoderm. This ectoderm shows a fold like this. It shows an invagination. This fold becomes deep and this fold gets separated off. What is this now? That's a neural tube. So this neural tube is derived from ectoderm. It is derived from ectoderm. The ectoderm invaginates like this and this ectoderm gets separated. So this is what forms the neural tube. That means the neural tube is what in origin? Ectodermal in origin. And जब ये neural tube ऐसे separate हो जाता है, when it gets separated from the ectoderm, it is not closed. It's not closed. It's open. It's open on the dorsal aspect. It's open from the head to the tail. The neural tube is open. And now this neural tube starts to close. Where does the closure begin? That's another MCQ for you. The closure of neural tube begins in the cervical region. The cervical region gradually it closes in front. Gradually it closes behind. Okay. The anterior end is still open and this is what we call as the cranial neuropore or the anterior neuropore. It closes by 25th day. The posterior neuropore closes by 28th day of intrauterine life. And during development, a small group of cells from the ectoderm also gets separated and they lie on either sides of the neural tube. What do you call this as? These cells which are separated from the ectoderm which lies on either sides of the neural tube. What do you call the cells as? These are called as the neural crest cells. Neural crest cells. And students, you should know this. This neural crest cells gives rise to a variety of structures. Plenty of structures are formed from this neural crest cells. One. Okay, I'll just enumerate these structures. This is very important. One is the adrenal medulla, adrenal medulla, leptomeninges. What is leptomeninges? It is the pia mater and arachnoid matter. Pia mater and arachnoid matter. Schwann cell. Schwann cell. What is the Schwann cell form? It forms myelin in the peripheral nervous system. Myelin in the peripheral nervous system is formed by Schwann cell. And myelin in CNS is formed by what? Oligodendrocytes. In CNS, it's oligodendrocytes. Then melanocytes. Melanocytes. Dorsal root ganglion. Dorsal root ganglion. Autonomic ganglion. Dorsal root ganglion, autonomic ganglion. Then endocardial cushions of the heart. Endocardial cushions of the heart. Just tell me one thing. Endocardial cushions of the heart are derived from neural crest cells. Agar ye endocardial cushions are not formed properly, what defect do you get? Can you tell me, students? If this endocardial, if this endocardial cushions of the heart are not formed, what defects do you get? बोल सकते हो? If the neural crest cells do not migrate into this endocardial cushions of the heart, if the endocardial cushions are not formed properly, what defects? नहीं, टॉफ नहीं होता है. Defect of which? कैसे बोलूं? Okay, you tell me. What are you? Can you answer? Defects of what? Defects of the interatrial and interventricular septum होता है. Okay, interatrial and interventricular septal defects होता है if the endocardial cushion of the heart is not formed. Okay, atrial septal defect and interventricular septal defects होते हैं. Because the septum has to come and fuse with what? The septum comes and fuses with the AV cushion. No, समझ में आ रहा है? जब atrium है ना, atrium, the interatrial septum जब बनता है, it has to come and fuse with the AV cushion. अगर AV cushion is not there, the interatrial septum will not be formed. There's a defect there. Similarly, interventricular septum partly is contributed by AV cushion. The membranous part of interventricular septum is formed by the AV cushion. So if the AV cushion is not formed, there will be a defect in the interventricular septum. Clear? So it's basically septal defects. फिर septal defects के बाद जो होता है tough overriding of aorta, that's a different thing. But main primary thing is, ठीक है? Then aortico pulmonary septum. ये है वो. In this aorticopulmonary septum, who's going to migrate neural crest cells? And if this neural crest cells do not migrate in this aorticopulmonary septum, we get this TOF. ये TOF है. Richard, clear? If the neural crest cells do not migrate into this aorticopulmonary septum is going to divide the truncus arteriosus into two big blood vessels, correct? The ascending aorta and the pulmonary trunk. If the neural crest cells do not migrate, you get defects here. One is TOF, one is TGA, transposition of great vessels, TGV, and third is a persistent truncus arteriosus. We'll see this later somewhere. Then corneal stroma, skeleton of the face, and parafollicular C cells of thyroid. Parafollicular C cells of thyroid. Facial skeleton it forms, facial skeleton. The neural crest cells are going to migrate into this facial skeleton. Okay. Parafollicular C cells of thyroid. Anything missed? So just remember all this. You get plenty of MCQs on this neural crest cells and all. So adrenal medulla, leptomeninges, Schwann cells, melanocytes, ओडोंटोब्लास्ट, ये एक रह गया ओडोंटोब्लास्ट. These are teeth forming cells. ये teeth बनाते हैं, teeth forming cells. Dorsal ganglion, autonomic ganglion, endocardial cushions of the heart, cranial nerves. Yes, cranial nerves भी बनाता है वो. Corneal stroma, skeleton of the face, parafollicular C cells of thyroid, and the odontoblast. Okay. Is this clear, students? I hope you've understood everything. And again, maybe tomorrow or day after, I'll plan a session for you on same, especially for the FMG students. Let us meet once again. I'll talk and I'll schedule the lecture. I'll just have a word and I'll schedule the lecture for you. Is there any doubt? Anything which is not clear? Students, please do ask. The session is open for doubts now. Okay. Thank you to all of you. Thank you to all of you. So we'll meet once again tomorrow. Thank you. God bless you. Thank you. Bye bye.